Good morning, everyone. My topic for today is demystifying the enigma behind aerosolization during phacoemulsification. Now, as we all know, there are almost 18 crore cases of COVID worldwide today. And also what has been documented is that COVID is spread through aerosols. So our research question was, are aerosols generated during phacoemulsification?
लास्ट प्रेजेंटेशन और है तो वो जजेस ने लिया है तो उसके बाद मैं एंड करती हूँ सेशन और जो हमारे नेक्स्ट स्पीकर्स है वो रेडी है ना
प्लीज म्यूट योरसेल्फ एवरीवन एल्स
उसमें से की स्पीकर
My material and methods were as follows. There were a string of experiments we did in collaboration with IISc Bangalore, which was rated as the #1 research center in the world recently. Our experimental setup had two arms, arm 1 and arm 2. In arm 1, a goat's eye was placed in a mannequin. An ultra high resolution, high speed camera, which captures almost 20,000 frames per second was used. And a high definition light, a Veritas strobe light was used. This shown in the photo is a shadowgraphy setup. So in shadowgraphy, along with a high resolution camera, can even image particles of size between 10 to 30 microns. We use different wound size and sleeve combinations. So here we see an incision size of 2.2 along with a sleeve size of 2.2. Here the incision size was larger of 2.8, sleeve size yet being 2.2. Here the incision size was 3.2. Here the incision and the sleeve size again were matched at 2.8. And here the incision and the sleeve size were 3.2 and 2.8 respectively. In the experimental setup too, we used a cadaveric human corneostelli mounted on an artificial anterior chamber. We performed dynamic phaco, that is actual phaco held in the hand of an operating surgeon, and also a static phaco where the phaco probe was attached and static. So what were the results of our study? When the phaco was performed with a sleeve size equal to the wound size, here on the left, we see a slow motion video and on the right, a shadowgraphy. Here we see that even at 2000 frames per second, there are absolutely no aerosols being generated whatsoever. When the phaco was performed with a sleeve size lesser than the wound size, we observed that there was a gentle trickle from the main wound, but there was no aerosolization at all. You could observe the gentle trickle on the shadowgraphy. When we performed the dynamic phaco in the anterior chamber, the findings were same. There was absolutely no aerosolization seen, either picked up on shadowgraphy or on a slow motion camera. And then we performed a static phaco at the corneal lip. That means the phaco probe, the tip of the phaco probe was at the lip of the wound. And in this case, what we observed was there was profuse amount of aerosolization, which is demonstrated both in a slow motion camera and in the shadowgraphy technique that we performed with at 2000 frames per second. So in conclusion, we found that phaco performed in the anterior chamber produces no aerosols whatsoever. A phaco performed with a wound size larger than the sleeve size can cause slow leak of fluid, which trickles down, but there is no aerosolization. And a phaco performed with the phaco probe tip at the wound causes profuse aerosolization. So what new does our study add? We were the first to use shadowgraphy and high-speed photography to demonstrate aerosol generation. We were the first study to demonstrate that no visible or invisible aerosols are generated during phacoemulsification, thus squashing all the rumors being published elsewhere. And the use of match tip, sleeve, and incision size and ultrasound power usage only after the tip is completely inside the anterior chamber ensures that there is no aerosolization whatsoever during phacoemulsification. Thank you.
Thank you, Nikhil, for a very interesting study. But just one quick question. This is a simulation studies, these are. Did you do it on actual patients in the OR?
Yes, sir. So in these studies were performed in two arms, one on the goat's eye and one on using the artificial anterior chamber, because the shadowgraphy technique.
No, that's fine. Did you do it in the setup in the OT is totally different, and
correct.
the
so
pressures
sir,
are different.
in the OT, what we did is we used a ultra high definition normal phone camera with a slow motion, and we found there was absolutely no aerosolization there either. We could not set up the shadowgraphy technique in an OT because the shadowgraphy, the technique in which you need the position of the whole setup has to be perfectly lying between a high intensity light and the camera, which could not calculate which not capture the images in a OT. So it was to simulate the exact conditions of like a OT is. That's why we performed our second arm on a artificial anterior chamber using a corneal scleral ring.